This is Dr. Din at your service with Laura.
Hi guys.
And we are back in business again after the initial lockdown is over. Well, we were meeting before also every now and then because she's my sister. What can you do? She's always with us. So anyway, Laura, how have you been?
Very well, thank you, very well. I think we have an interesting topic that I can't wait to get into and discuss.
Yes, so the topic of discussion today is Femilift. Now, what is Femilift? That is a big question. So the Femilift is like a laser, which is a CO2 laser that we do for vaginal rejuvenation. And this is basically something that we use for women who who suffer from incontinence, urinary incontinence, or have dryness, excessive dryness. Usually after childbirth, if they have normal vaginal deliveries, and they have multiple deliveries, they can start experiencing some urinary incontinence at points, and that can sometimes get worse as they age. So Femilift comes into play at that time.
Okay. What is the cost of it roughly?
This is different. We also do it. It's like a series of 3 or 4 treatments depending on what your symptoms are. So roughly it ranges. It depends on where you're getting it. If you're getting in New York, it would probably cost you a little more, like around $800, $900, sometimes even $1,000 per session. And if you're doing it in some small town, there is a possibility that it is cheaper. And if your GYN or gynecologist is doing it in combination with some other treatments, then sometimes it's built into the cost of several other procedures. Like we have our mommy makeover packages, where it's part of our mommy makeover packages.
Does insurance cover it?
So far, insurance does not cover it, and we are basically giving it to those people who either do not have insurance or do not want to take the medications that insurance covers. So for urinary incontinence and stuff, we do have medications that we give people, and a lot of women do not want to take those medications forever, so they usually want something else.
Besides urinary incontinence and dryness, what else? Can it be used post-menopause, pre-menopause? Is it only for women of a certain age, like childbearing age, you said? But I mean,
but after menopause, when women start their estrogen levels start decreasing, at that point they suffer from a lot of dryness. So that can cause painful intercourse. Sometimes it can cause urinary tract infections and stuff like that. So that also does get a lot of help when you routinely do. So I sometimes explain it to my clients, like, imagine when you go and do a laser for your face, for your facial skin, and it rejuvenates not only your small wrinkles and stuff. The same thing can be done for some of your pelvic parts also, because as we age, it's not just one part of our system that ages, it's like the entire body that starts aging, and some of the functionality can be enhanced, can be improved with some of these treatments. So when you do a laser for your skin, facial skin, it really improves the skin, and a lot of people who have experienced it will tell you that how beneficial a laser treatment can be over so many other things. Similarly, Femilift, we have noticed, I've been using it in my practice for like over 3 years now, and like almost 99.99% satisfaction rate.
Do you use a numbing cream or anesthesia for it?
So this is like a procedure which is like very, very kind of pain-free. It's like inconvenient because, you know, when you go for a pap smear or something, women would know it's like inconvenient, but it is generally pain-free. There is no anesthesia required. It's like maybe a 10 to 15 minute process. We want people to make sure that they've done their pap smears and they're normal, because that's the only time that we can do anything. We do not only actually, so the functional part of Femilift is that, you know, we do the internal tightening, the collagen synthesis, and basically the elasticity of the vaginal area is really, as we get older, it becomes lax. So basically it just helps you get your muscles back in tone. But we also are noticing that now women are becoming more self-aware, and they are interested in maintaining their entire bodies and their entire functionalities, and for a long time, because we're just living longer. So I know women who are in their 60s and 70s, and they're sexually active, they're very healthy, they want to lead full lives. And for them, it is very important to make sure that all parts of their body is functioning. It's not just the face, or not just the just one or the other part. So they definitely can benefit from it. But then again, it's more of maintenance. So as your question about like what age group, any age group can be with this.
And how long can you have sex after you have the treatment?
All right, so basically Laura is being shy, but what she's trying to ask is that what is the downtime of this procedure?
What is the downtime? Don't we want to know that? Forget about all this other stuff.
And especially Laura definitely wants to know, because then she can put her boyfriends on schedule. Like, all right, you're...
Okay, hold on. Hold on. I
That's
need a week,
editing.
and then we can get back to business.
Yeah, exactly. So, no, yes. So, definitely you will need like 4 treatments. For instance, 3 to 4 treatments for this particular session with this laser. And there are actually lasers like Genevieve, which says that only 1 treatment, but I know people who have to go and do a 2nd and 3rd treatment there too. So basically it's monthly treatments, but the thing is that you have a downtime of, the company says 3 to 4 days, but I like to tell people to abstain for at least 6 to 7 days. We usually want to make sure that we do it when you're not on your period, and that is it. It does not hurt. And we also are now seeing more, like this laser is also capable of external tightening, not just internal, and also collagen support.
So you would use this machine internally and outwardly, and not, as opposed to using like a filler.
No, so we do offer fillers for labial reconstruction. But this is going to help. This tightens, you know, so filler does not really tighten. It just fills the defects. You know, it's like
Plumps you up?
Yes, it pumps you up. Pumps you up.
I have a question.
Yes.
How do you know if you need filler on your labia?
So, you know, just like when we take pictures of your lip or of your face, we also take pictures, and basically people
you take
check.
A picture, yeah.
Yes.
I don't check. Do you check?
Me? I all the time. I check others.
I don't check.
All right. So, you know, listen, this is not, it's like, you'd be surprised how self-aware women are, and they are self-aware now because their partners are more self-aware. Because many times, you know, we were not that self-aware because it was just us being aware of our partner. But now as men are becoming more self-aware, they are also paying attention to women in a different way, and that is making women want to take care of themselves, which is, I think, positive. Anything that helps you look after yourself and take care of your body in the long term or the short term is good. Many of these procedures and processes are not covered by insurance. What I personally don't approve of is cosmetic surgeries in the pelvic area. I mean, the only time I would recommend a surgery to somebody, because I'm in family medicine, we're just basically always looking for non-surgical procedures to rejuvenate and help ourselves. But surgery should only be left as the last resort, and only for like pathology or diseases that you just can't help. So that is that. So Thank you so much, Laura, for asking these very, very important questions.
Absolutely.
Is there anything else that you're missing? And otherwise, we can finish our small talk session.
I mean, I could keep going with this topic all day.
Oh, really? I know. So that is great. We will keep talking. But for our listeners and viewers, if you want to ask any questions and if you want to know if this procedure is right for you, please contact us on our website, which is www.juvanni.com, and ask for a virtual consultation. It is usually free of any charge, and we should be able to tell you if you are a good candidate for it and what are the next steps.
Great.
Take care, and we will see you soon.
Bye.
Bye.